In this video, we're going to have a look at how to support Assessment Task 6, Assignment 4. So for this assignment, you're going to base it on the clinic that you are doing your placement at. So you need to answer each of the following questions. So what I recommend is copying these questions into a Word document or something similar so that you can make sure you are covering each of these points. So you need to discuss what procedure is followed when a client arrives for their first appointment. So is there a specific form that they need to fill out? Is there somebody they need to talk to? What information is provided to that client at their first appointment? What service options are available at the clinic? So this could be anything, okay? Especially if you're working in a multidisciplinary clinic, they might offer several services such as physio, massage, podiatry, chiropractic. You need to identify how the clinic provides individualized services for the clients. So how do they make sure that each client is getting the treatment that they deserve and not just a standard template for everybody? You need to identify who's involved in the client service planning process. So is it just one practitioner or do several practitioners work together? Does your supervisor deal with any health professionals from other clinics or hospitals? So is there anyone that they work with on a regular basis or that they have a strong referral network with? What steps are involved in planning a consultation between the client and the health professional? So do they need to see somebody in between, or can they make that appointment directly with the health professional? So the only person they're really needing to speak to is maybe the receptionist. What information is collected to assist the health professionals? So are they having to do a client intake form? Do they have to take x-rays? Do they have to have blood tests? What resources are required for the daily operations of the business? Okay, so this can be things even from the reception area, okay, and a computer to client intake forms, but depending on what the business is actually operating and what services they are providing, there can be other things in this as well. Okay, so it can include things like a treatment table. What goal-setting processes are used to initiate and maintain the client's motivation to follow the program? So are they given anything to take with them? Are they shown different exercises and exercise equipment that they can use? How is a client's treatment followed up by the clinic? So do they get phone calls? Is there anything? Do they need to come in for an additional appointment? And what process is followed when the client finishes their program or is referred to another service? So is there any follow-up? Once they've left your clinic and gone somewhere else, does the person you're working with actually know what happened to them? If your clinic doesn't follow any of these processes that are listed above, mention that, but put in a suggestion of a way that a process could be implemented. So if the clinic you're working with doesn't deal with any other healthcare professionals or hospitals, put in a suggestion of how that could be implemented. Okay, so maybe the person that you're working with could set up a meeting with a certain health professional or with a hospital to be able to set up a referral network. In total, this should be between 800 and 1,000 words. So it's roughly 100 words per point. If you have any questions, please chat with your trainer and they'll be able to further clarify.